Can anyone see my screen now?
Yes, we're able to see your screen.
Okay, so I am going to start. My name is Steven. I want to talk to you about this novel method to treat androgenetic alopecia using microneedle radio frequency with topical minoxidil. This is a pilot study that I did. This is my CV. I graduated from Erlangga University in Indonesia, and I did my postgraduate medical training, dermatology training, over at Boston University Medical Center in the United States of America. And below are the memberships, publications, and journal reviews that I did. Okay, first of all, androgenetic alopecia, an extremely common condition. A lot of you most of you would have seen this. Some of you may experience this. This is an extremely common condition. What happens is that there is a miniaturization of the hair due to this androgenic hormone, and some people are just susceptible to this hormone, causing this condition called androgenetic alopecia. And as I said before, very common, happen in about 70% of male and 40% in females. Righty, so in order to know how to treat this, we need to know, how does AGA occur? So on your right-hand side here, you can see these words antigen. There's the catagen, there's the telogen, and another antigen. So I'm just going to briefly go over this. The antigen is the growing phase. This is what determines the length of the hair. And then you would have the catagen, which is the stopping of the growth phase. And then you would have the telogen, the shedding phase. And then after that, you would have the antigen. So if you imagine it this way, so here, I'm just going to draw it right here. You would have the antigen going all the way from here to here. And then you have the catagen right here, and then you would have the telogen. So a lot of my patients tell me that, doctor, I used to have a lot of hair when I was a kid, and now I lost all my hair. Where has all my hair gone? So the expression that that a patient or humans losing their hair is actually incorrect, because humans are actually born with the same number of follicles from baby to adulthood. So what happens is that there is a shortening of the antigen phase. So instead of the antigen phase going all the way to here, you would have the antigen phase maybe here, and then you would have the catagen here. Or it can get really progressively worse, and then the catagen may start over here. And again, as I said before, the antigen is the determinant of the length of human hair. So when you have the catagen right here instead of its normal position right here, then you would have what you call a miniaturized hair. And eventually, this hair goes really short, and it kind of like goes really close or even hide under the scalp and cause baldness. Okay, so this is the normal hair compared to this is the scalp with the normal hair compared to someone with an AGA. And you can see here on the left side here, you have this antigen hair going all the way from the superficial part of the scalp, the epidermis, all the way to the subcutaneous area. So this is a pretty long hair, healthy hair. And your right-hand side here, there is this scalp with androgenetic alopecia. And you can see here that the hair follicles, they don't go as deep anymore. They only go all the way up to this lower dermis, and then they stop. So there is indeed a decrease in the size of anagen hair follicles, so-called miniaturization. There are also increase in the number of telogen hair follicles, because you would have more telogen now that the anagen is shortened. You would also have the fibrous tracts here. Oh, where's the fibrous tracts? Oh, right around here. Okay. So the question is, we know that the problem is the shortened anagen phase. The anagen is too short. How do we extend it? These are the current treatments that we have for AGA. So we have the minoxidil. we have the finasteride, we have the dutasteride. There's also the cyproterone acetate, the spironolactone, the latanoprost, the ketoconazole shampoo. There's also the fancy LLLTs. They can come in form of a helmet or a comb, for instance. There's the PRP. There's the microneedles and fractional lasers, the erbium glass, erbium yak, and CO2s. And also there's the hair transplant that's been there for quite a while already. And yet we are still trying. So far, only 3 methods are FDA approved. Minoxidil is the classic treatment. I used to be trained to talk to patients that minoxidil is the only medication at the time that was FDA approved. There's the 2% and the 5%, but both of them offers relatively low efficacy. And during the first month, you can also have an increase of the shedding, which reduces compliance and patients no longer want to use it. What about LLT? So the LLT, we've looked into it for a while, but the thing is that with LLT, there's no variable wavelength. Some people recommend 630, some people recommend 655 and other wavelengths, and there are no consensus. Some methods are also limited to women only, for example, like cyproterone acetate or spironolactones. Obviously, you can't use those in men. And some methods are actually reserved for men only. For example, finasterides, although you can use it for postmenopausal women. Some methods are very difficult to perform. They're either too expensive and need extra preparation, for example, shaving hair, and you can have a longer downtime. This goes with hair transplants. So, do we have any new ideas? This is my thought at looking at all these treatments. What about this fractional radiofrequency microneedling? So, in essence, fractional radiofrequency microneedling is a minimally invasive procedure. Okay, so it's not very invasive. It is a combination of microneedle and RF energy. What it does is that it delivers bipolar RF through insulated or non-insulated microneedles, you can pick, and it creates a controlled thermal zone at selected depth. I'm going to talk a bit more about this later on. So, Secret RF is an extremely useful dermatology tool. I've used it for a number of years now. It is a fractional radiofrequency microneedle, and what it does is that it utilizes bipolar radiofrequency. You can either choose the 10 pin, the 25 pin, or the 64 pins, and you can choose either insulated or semi-insulated. There is also the option to use the monopolar radiofrequency. There's the 1 pin, the 4 pin. There are also pins for vascular, substitution, and lipolysis cartridge. Excuse me. It can emit wattage to up to 70 watt on the 64 pin, 25 watt on the 25 pin, and 45 watts on the monopolar. So a pretty strong machine. So I'm going to talk more about the 25 pins. This is what I picked. Okay, first of all, that's what I picked because it is suitable size-wise. You can adjust intensity from a 0 all the way to 100. You can adjust the pulse width, so you can set how long you want the machine to fire. And this is what I want to talk to you about. This is very important, is that there are variable choices of depth. You can go from 0.1 millimeter all the way to 3.5 millimeters. And you can choose how fast you want to fire the machine, or how fast it depends on how fast you want to go. Okay, so this is how it works. So the microneedle cartridge is placed on the skin surface. Remember, you have to place all this surface, this contact point, evenly on the skin. Otherwise, you would have an uneven treatment. And when you fire, when you press on the pedal, you would have these microneedles penetrating inside of the skin. And then again, the depth is, you choose the depth. And after that, the bipolar RF energy will be applied to all these target areas. And you would have this collagen regeneration and elastin production. And this is why this device is great for rejuvenation, facial laxity, pores, wrinkles, and acne scars. So this is the study. The aim is to observe the effect of Secret RF, the microneedle RF, in combination with the classic treatment, 5% topical minoxidils. We enrolled about 10 males. We used EMLA as our topical anesthesia. We did it for about 45 minutes prior to procedure. And the interval was 4 weekly with minoxidil application right after. And then the patients were still instructed to apply 5% minoxidil twice daily. And we took images during every follow-up visit. Okay, so this is a patient that I did. This patient has just had his EMLA removed from his hair, so it's kind of like wet. And when the hair is wet, you can kind of see the affected areas more clearly here. So I'm just going to draw it right here so that everyone can see. And so this is the affected area. You would want to take the picture from the back and from the front. What can I try? Oh, there it is. Okay, so here are the approximate affected areas. And then this is what we call the frontal hairline recession. And then you would want to kind of like look at the borders. Okay, so where do you fire the treatment? Where do you place your microneedle cartridges? Obviously, you would want to place them on all these affected areas, all the way here. So I like to do it from right to left or left to right. You can do it systemically or non-systemically at your own choosing. So as long as you cover all the spaces, you obviously want to cover all these areas. And besides this, you would want to do it on the border area, so the areas between the affected and the non-affected areas. Right here. And what I like to do is that I like to treat the seemingly unaffected area adjacent to the borders. So right along the outer borders right here. Same goes to the other image right here. Okay. So what about this frontal area? So in this frontal hairline recession, the affected areas are the bald parts, obviously. So you want to treat this area, the areas in front of the hairline. You would want to treat the hairline areas, which is the border. And you would want to treat the seemingly unaffected areas inside the hair. So these are the 3 areas that you want to treat. You don't have to do the whole scalp, but these are the most important areas you want to cover. Okay, so this is the video of me doing the treatment. Just gonna try to play. Oh, it plays. Okay, so this is how I like to do it. I like to go from right to left, and I do it slowly. I was talking to the patient while I was doing this, so it doesn't seem to be very painful. Right to left, and I like to go a little bit fast here, and I like to go at it, I like to cover areas multiple times because there may be some areas that I miss. And sometimes I also do it instead of from right to left, I also do it from back to front. So as long as you cover everything, the way you do it doesn't really matter. And on your right hand side here, you might be able to see this mild redness. And obviously you would want to cover all these areas between the redness, but that's the kind of the rough idea of your endpoint. So you don't want to be too red, but you don't want it to be not red. So just this mild erythema would do. Okay. So how does it work, right? So obviously there are methods on how it works. So a Secret RF, the microneedle RF, insert microneedles and release radio frequency energy. This causes vibration of the polar molecules and creates thermal energy, heat. And the heat causes inflammation. And this creates an increased blood flow and follicular vascularization. And all of these induces premature antigen entry. So you have a faster entry into antigen from, remember, if you have the antigen, the catagen, telogen, and another antigen. So you would have a faster entry to the new antigen. What about the wound? So the wound created by the needle actually stimulates stem cell populations and promotes differentiation of follicles. This is through the Wen, beta-catenin, and the left-1 signaling pathway. And the wound itself, it creates a pathway. It creates a pathway from the minoxidil to actually get deeper into the scalp. So what about the choice of parameters? So on the hand side here, you see this cross-section of a hair. You have the infundibulum, you have the isthmus, you have the suprabulbar, and the bulb. And according to the studies that I've reviewed, is that the depth between the superficial part of the epidermis all the way to the end of the isthmus, where the erectropyli kind of inserts into the hair, where the bulge area is right around 1.5 to 1.6 millimeters. So what is the significance of this bulge area? This bulge area contains a lot of stem cells that we want to stimulate. So this is why we use the 1.5 millimeter depth. We use intensity about 30% and duration about 70 to 90 ms depending on the pain level. So what happens if you use too much energy? This too much energy can actually disrupt the structural integrity of the follicular structure. You can destroy it. So instead of growing hair, you can actually make the patient bald. And this would likely be permanent. Okay, to see it microscopically, on the left-hand side here, image A, is that when you have a scalp and there is a microneedle being done on this scalp, particular scalp, the energy was delivered was so high, it causes a coagulation of the follicular epithelium and the perifollicular structure surrounding it. It destroys the whole hair follicles. If you can see it, there is fibrosis of these hair follicles. And this will cause permanent scarring, so very, very dangerous. But instead, on the B here, when you have just the right amount of energy, you would have this entrance, this hole is due to the microneedle, but you would still have this preservation of the hair follicles. And several days later, and in this study by Zheng et al., it's 4 days later, there is still preservation of the hair follicles. But you can start to see here, there is revitalization, there's some mixed cellular infiltration, neovascularization, and granulation tissue formation around the hair follicles. Again, with preserved follicular structural integrity. Okay, what about compared to other modalities, right? So CO2s can create pathway channels as well. It can create heat too. Sure it does, but it can damage the existing hair. So unless though you want to shave the patient's hair while treating it, I don't suggest CO2 lasers. You can approximate the depth of CO2 lasers, but you can't expect it to be extremely precise. But in Secret RF, you can basically punch the numbers and you will get the same depth every time. And also in CO2 lasers, crust may occur, and this may be perceived by the patient as dangerous. And what about regular microneedle? Now, regular microneedle works, but we find that it induces more pain, and often patient has a longer downtime due to edema. So these are the results. You can clearly see more of the scalp on the left side, experience and a really significant increase in hair density, and he's very happy. But to right around these areas only. So the patient is extremely happy about these results. Okay, what about this guy? So this guy experienced androgenetic alopecia from all the way from the front all the way to the occipital perianal area. This is not the right angle, but you can clearly see here on the occipitoparietal area or the vertex area as well, is that there is an increase in hair density. This is a much better image that I took, is that clearly you can see an amazing increase of hair density. So instead of having all this thin hair from the front all the way to the back of the scalp, the androgenetic alopecia is kind of isolated on this area as well, on the occipitoparietal areas. So patients very happy, amazing increase in hair density, very satisfied. What about the frontal hair? So in this patient, there is still some frontal hair recession. But if you look at the strands more carefully, there is an increase in hair density on the frontal hairline. This is why it's extremely important that we do on the affected area, on the borders, and also on the seemingly unaffected areas. What about adverse effects? Obviously, there can be some pain. Most patients do not feel much after the AMLA. And there are some redness on the scalp that will subside in a few days, usually 2 to 3 days. These are some of the questions that my patient usually asks me. How long does the procedure take? So the length of the procedure is usually depends on the affected area. The larger it is, obviously, the longer it will take. Is anesthesia absolutely necessary? I've done this with a couple of patients without anesthesia, and they feel like waiting for the anesthesia for about 45 minutes is not, takes too much of their time, and they would rather have it immediately. What about downtime? Well, essentially, no. There's really no downtime. You can go back to work the day after. But I would advise the patient to not use hair products or hair tonics or even wax, hair wax or hair clays, pomades for about 5 days post-procedure. So is it dangerous? No, it's actually very safe as long as you know the right parameters. Again, the choice of parameters is extremely important, because if you are too excited about treating this patient, you may cause a coagulation of the follicular and perifollicular structures and cause permanent scarring. And you also have to be very cautious for those with primary cicatricial alopecia, for example, lichen planopilaris, or patients with autoimmune condition, because this can induce inflammation and worsening of their hair conditions. There will also be a possible contact dermatitis from minoxidil as well. All right, so what are the key points that we learned here? AGA is a lifelong condition. As the name implies, androgenetic alopecia. The word genetic is there. So it is a lifelong condition. Many treatments, only 3 are FDA approved, relatively low efficacy. This Secret RF, Microneedle RF, can now be used as a novel way to treat AGA, but you need to have the correct parameter. And you need to wait between the treatments. So we choose 4 weeks because we feel like it gives the hair enough time to heal and to have this premature anagen entry. And we need to have patience, because not everyone will have great results after 1 treatment. Some of our patients have good results after 3 treatments. Some patients experience worsening after the 2nd treatment, and after that, improvement after the 4th session. So you need to be very patient here. Alrighty, thank you very much. And I will take some questions now.
Thank you so very much, Dr. Stefan, about the lecture. It was very informative. And okay, I think that all of the doctors that present here will...
Bạn muốn một mái tóc óng ư? Chỉ dùng gội thôi không đủ. Bạn cần kem xả Pantene 3 phút dịu kỳ sau mỗi lần gội. Giúp provitamin và serum dịu nhẹ, cung cấp provitamin cho...